If you ever have to inject your young child or infant using AUVI-Q epinephrine injection USP, the auto-injector is equipped with helpful voice instructions. You simply start by pulling the AUVI-Q up from its outer case. The voice instructions will walk you through the injection process. The auto-injector will operate, even if the voice instructions do not. I'll demonstrate in one moment. But first, this is important to know. Only inject into the outer thigh through clothing if necessary. When administering AUVI-Q to a young child or infant, hold their leg firmly in place before and during the injection to minimize risk of injury. Let's get started.
If having an allergic emergency, pull red safety guard down and off of AUVI-Q. Place black end against outer thigh, then push firmly until you hear a click and hiss sound, and hold in place for 2 seconds. 2, 1. Injection complete. Seek medical care if needed. This AUVI-Q has been used and should be taken to your physician for proper disposal and a prescription refill.
What is AUVI-Q? AUVI-Q epinephrine injection is a prescription medicine used to treat life-threatening allergic reactions, including anaphylaxis, in adults and children who weigh 16.5 pounds or more who are at risk for or have a history of serious allergic reactions. AUVI-Q is for immediate self or caregiver administration. Important safety information. What is the most important information I should know about AUVI-Q? Always carry 2 AUVI-Q devices with you, because you may not know when a life-threatening allergic reaction may happen. If a second dose of AUVI-Q is needed, it should be given starting 5 minutes after the first. If you need more than 2 doses of epinephrine for a single anaphylaxis episode, more doses must be given by a healthcare provider. Talk to your healthcare provider about when it is necessary to get medical care for further treatment of the allergic emergency after using AUVI-Q. If you have certain medical conditions or take certain medicines, your condition may get worse, or you may have more or longer-lasting side effects when you use AUVI-Q. Before using AUVI-Q, tell your healthcare provider about all of your medical conditions, especially if you have heart problems, high blood pressure, diabetes, thyroid problems, kidney problems, history of depression, Parkinson's disease, or are pregnant or plan to become pregnant, are breastfeeding or plan to breastfeed. Tell your healthcare provider about all the medicines you take, including prescription and non-prescription medicines, vitamins, and herbal supplements. AUVI-Q and other medicines may affect each other, causing side effects. AUVI-Q may cause serious side effects. AUVI-Q should only be injected into your outer thigh, through your clothing if necessary. Do not inject AUVI-Q into your veins, buttocks, fingers, toes, hands, or feet. If this occurs, go to the nearest hospital emergency room right away and inform the healthcare provider of the location of the accidental injection. Rarely, people who use AUVI-Q may get infections at the injection site within a few days of an injection. Some of these infections can be serious. Call your healthcare provider right away if you have any of the following at an injection site: redness that does not go away, swelling, tenderness, the area feels warm to the touch. If you inject a young child or infant with AUVI-Q, hold their leg firmly in place before and during the injection to prevent injuries. Ask your healthcare provider to show you how to properly hold the leg during an injection. Common side effects of AUVI-Q include fast, irregular, or pounding heartbeat, sweating, shakiness, headache, paleness, feelings of overexcitement, nervousness, or anxiety, weakness, dizziness, nausea and vomiting, breathing problems. Tell your healthcare provider if you have any side effect that bothers you or does not go away. These are not all of the possible side effects of AUVI-Q. You are encouraged to report side effects to Kaleo Inc. at 1-877-302-8847 or to the FDA at www.fda.gov/medwatch or 1-800-FDA-1088.